As you probably know, our bodies are made up of cells. For the purposes of this explanation, we will represent a cell with this blue circle. In normal, healthy bodies, cells grow and divide all the time. When a cell gets damaged or becomes old, it effectively commits suicide. This process is called apoptosis. However, sometimes these old or damaged cells do not die, but instead start multiplying rapidly out of control. The mass of cells that is formed as a result is known as a tumor. This is how a cancer tumor develops. As the tumor continues to grow, it invades the surrounding tissues. Small pieces of the tumor can break off and be transported around the body through either the blood or the lymph systems. They can get stuck in other organs, and as the cells continue to multiply, new tumors develop. This process of cancer spreading to other parts of the body is called metastasis. It is important to point out that while many cancers form tumors in this way, blood cancers are different because no tumors develop. Cancer can develop in just about any part of the body. There are actually about 200 different types of cancers. We've also talked about how cancer can spread from one part of the body to another. Cancer cells usually look like the cells of the organ in which the cancer originally began. And for this reason, cancers are named after the organs in which they start. So for example, lung cancer cells have the same basic structure as healthy lung cells. If the lung cancer then spreads to another part of the body, like the liver, for example, the cancer cells will still look like lung cells, and the cancer is not then called liver cancer. It is called lung cancer that has spread or metastasized to the liver. It is important for doctors to identify which organ the cancer started in, and therefore what type of cancer it is, because there are different types of treatments for different types of cancers, so it's important that the cancer is treated correctly. Different cancers also have different patterns of spreading to other organs around the body. For example, lung cancer will usually spread to the other lung, the liver, the bone, and the brain. Colon cancer spreads to the liver, the lungs, and the peritoneum, which is the membrane lining the abdominal cavity. In addition to being named according to their original location in the body, cancers are also classified into 5 main groups by their histological characteristics. In other words, by what they look like under a microscope. These 5 groups are carcinoma, sarcoma, myeloma, leukemia, and lymphoma. In addition, there are also some mixed types. Some of this can get quite technical, but let's try to simplify it as much as we can. A carcinoma is a type of cancer that starts in the cells that make up the skin or the tissue that lines internal organs, such as the liver or the kidneys. For example, if somebody has kidney cancer, they may have a renal cell carcinoma. That means that they have a cancerous tumor in the cells lining the kidney, since the term renal indicates something that relates to the kidneys. A sarcoma is a type of cancer that starts in connective tissues like bone or various types of soft tissue like fats, muscle, nerves, fibrous tissues, blood vessels, or deep skin tissues. These can be found in any parts of the body. An example is somebody with ovarian cancer, which is cancer of the ovaries, who has a liposarcoma. This would be a tumor in the fatty tissues of the ovaries. Myelomas are tumors that begin in the bone marrow. Now, the bone marrow is the spongy tissue that's found in the middle of your bones. Its function is to produce red blood cells that carry oxygen throughout your body, white blood cells that fight infections, and platelets that help your blood to clot when you are injured. So you can understand that when the bone marrow is damaged by cancer, many other parts of the body start to suffer as well. Leukemia is a cancer of the blood, where cancer cells, which are mainly damaged white blood cells, circulate in the blood throughout the body. Lastly, a lymphoma is a cancer that begins in the infection-fighting cells of the immune system. These are called lymphocytes. These cells are found in the lymph nodes, in the spleen, in the thymus, the bone marrow, and other parts of the body. Now that we understand how cancer develops, the question we need to ask is, why does this happen? Why does the natural process of apoptosis or cell suicide sometimes go wrong? Sometimes the problem is our genetics, but not as often as we think. Less than 10% of cancers are caused by genetic factors. The vast majority are caused by factors in our lifestyle and our environment. Let's look at this in some more detail. Take a look at the following pie chart, which lists the main causes of cancer and how much each one is thought to contribute to the incidence of cancer. We will then discuss each of the causes in some more detail. The cancers that most commonly have a genetic link are breast, prostate, colon, and ovarian cancers. Bear in mind that having a particular gene for a particular cancer does not guarantee that somebody will develop that type of cancer, but it does increase that person's risk. After many years of research, the links between tobacco use and cancer are very clear. I think we all know that. About 40% of cancers are caused by tobacco use, so it's quite high. Lung cancer is the most obvious cancer that's linked to tobacco, but there are many others that we need to be aware of as well. Some of them are perhaps not surprising, like cancers of the mouth, the larynx, which is the voice box, the pharynx, which is the upper throat, the nose, the sinuses, and the esophagus, which is the food pipe. But some surprising cancers are liver, pancreas, stomach, kidney, bladder, cervix, and bowel, as well as one type of ovarian cancer and even some types of leukemias. There is also some evidence that tobacco use could increase the risk for breast cancer. Don't forget that it is not only smokers who are affected, but those who live and socialize with them and breathe in the same smoke. When talking about tobacco, it is important to ensure that we include these devices, commonly known as hookahs, water pipes, hubblies, shisas, gauzas, or bongs. There is a common belief that these are less harmful than cigarettes, but nothing could be further from the truth. Unfortunately, the water does not clean the smoke as many people think it does. It does not filter out the impurities. The smoke is full of poisons as it enters your lungs. Not only that, but consider the fact that a hubbly smoker takes about 100 puffs in a single session of about 45 minutes, whereas smoking one cigarette involves only about 10 puffs. This means that you are inhaling many times more tar, nicotine, tobacco, and carbon monoxide in one session with a hubbly than when smoking one cigarette. This is besides the risk of developing TB, herpes, COVID, and other diseases that are commonly transferred during hubbly sessions. So, hubblies are certainly not a safer option. It is important to mention that it is never too late to stop smoking. A person's body experiences health benefits right from the first days and weeks that smoking stops, such as lowered carbon monoxide levels, improved circulation, and increased lung function. A year after smoking stops, the risk of heart disease is approximately half of what it would have been had smoking continued. Infections in the human body are caused by viruses, bacteria, or parasites. About 15% of cancers are caused by infections that, for various reasons, a person's immune system has not been able to resolve. Let's start by talking about viruses. The main viruses that can lead to the development of cancer in humans are the following. The Epstein-Barr virus. This is a very common virus that can cause nasopharyngeal cancer, which is cancer in the area at the back of the nose and the throat, and some types of lymphomas. Most of us will have been infected with the Epstein-Barr virus at some point in our lives, but most of the time, the immune system is able to deal with it effectively. The human papillomavirus, known as HPV. This is the virus that is largely responsible for the development of cervical cancer. The hepatitis B and C viruses, these are behind many cases of liver cancer. The human herpes virus 8, which is linked with the development of a cancer called Kaposi sarcoma. This causes abnormal lesions in the lining of several organs around the body, and these develop simultaneously, not one at a time, as with most other cancers. Lastly, there's the human T lymphotropic virus type 1, which most of us have never heard of, but it can lead to the development of leukemia. In terms of bacteria, the primary problem is an organism called Helicobacter pylori, which is the scientific name for the type of bacterium that causes stomach ulcers. This is the first bacterium to have been identified as a definite cause of cancer in humans by the International Agency for Research on Cancer. So, for those of us who suffer from stomach ulcers, it's important to get them treated rather than risk them developing into cancer. Bilharzia is an infection that develops from parasitic worms. Depending on the type of worm that caused the bilharzia, the untreated illness could lead to the development of cancer, particularly bladder cancer. Lifestyle factors, which also cause about 15% of cancers, are mainly linked to diet and lack of exercise. Most of us know that we should eat balanced meals with plenty of fresh fruit and vegetables, that we should limit the intake of red meat and processed meat, and that we should exercise on a regular basis to maintain a healthy body weight. But most of us don't do this very well, and this has serious implications for our health. About 12% of cancers are thought to be caused by factors in our environment. These include UV radiation from the sun or from sunbeds or tanning booths, from air pollution, or from exposure to hazardous substances in mines or factories, like benzene or asbestos, to name just a few. One of the things most people don't want to hear is that alcohol is classified as a Group 1 carcinogen. In other words, it is proven to cause cancer in humans. Alcohol has been shown to be responsible for cancers of the mouth, pharynx, larynx, esophagus, liver, colon, rectum, and female breast. Even so-called light drinking has been linked to causing cancers of the mouth, esophagus, and breast. There is no safe level of alcohol consumption, and the more one drinks, the greater the cancer risk. You have probably heard people talking about the stage that their cancer is in. Staging is a way of indicating how big the initial tumor is and how far it has spread. Different staging systems are used for different types of cancers. Cancer staging can be quite complex and involve multiple factors, but to give you a basic understanding, we will try to keep it simple. One staging system involves classifying the cancer using Roman numerals from 0 to 4. There may be slight variations on the meaning of each stage with different types of cancers, but this will give you a general idea about how staging works. In stage 0, there are abnormal cells present, but they are not yet classified as cancerous and have not spread. In stage 1, the cells have formed a small tumor. In stage 2, the tumor has grown, but has not yet spread beyond the original organ. In stage 3, the tumor is larger, and it has spread into the surrounding tissues and/or the lymph nodes. In stage 4, the cancer has spread into at least one other organ. A second way of staging cancer is the TNM system, which is often used for breast cancer. In this system, T refers to the size of the tumor, N refers to whether the cancer has spread to the lymph nodes, and if so, how many. M refers to whether the cancer has metastasized or spread to other organs, and if so, how many. In this system, each letter will be allocated a number, for example, T3, N2, M0. The higher the number, the more advanced the cancer. Now that we have a basic understanding of what cancer is and how it develops, we will look at the different types of treatments that are available. It is important to note that doctors will develop an individual treatment plan for each patient, depending on their type of cancer and the stage of cancer. So just because two people have the same type of cancer, it does not mean that they will get exactly the same treatment, or that the types of treatments they have will be given in the same order. First, we will talk about surgery. Surgery can be used for different purposes in cancer patients. The most obvious is to remove cancer cells as completely as possible. This is called a curative use of surgery. A tumor may also be debulked, in other words, made smaller, before other types of treatments are administered. This is often used when a tumor has invaded the surrounding tissue quite significantly and cannot be fully removed without damaging other organs. Surgery can also be used as a means of palliative care, in other words, controlling the pain and other symptoms in patients. Nowadays, there's an increasing use of robotic surgery, which allows surgeons to perform more complex procedures with greater precision. This makes the surgery less invasive for the patients because so much can be done through very small holes, and recovery time after the surgery is much shorter. The second type of treatment we will look at is called external beam radiation therapy. Now, radiation therapy, which is also known as radiotherapy, treats cancer by using very high doses of radiation to kill the cancer cells in order to shrink tumors. This radiation is projected onto a very specific area of the body, which has actually been marked out with a pen on the person's skin beforehand. The goal is to kill the cancer cells without damaging the surrounding healthy cells. Radiation therapy can be used before, during, or after other types of cancer treatment. Like surgery, it can be used to treat the cancer, or it can be used for palliation, in other words, to reduce discomfort in patients. There are many potential side effects of radiotherapy. Not all patients will experience side effects. Some will have none or very few, while others will experience many. But here are a list of some of the most common side effects that you will hear about. Body weakness or discomfort, reduced immunity, so susceptibility to getting more illnesses, especially like colds and flu, nausea, vomiting, loss of appetite, an altered sense of taste, headaches, temporary hair loss, problems with the skin, like pain, peeling, redness, darker patches on the skin, itching, inflammation of membranes, for example, membranes in the mouth, an increased heart rate, fluid retention, so for example, swelling in the feet and ankles, and muscle decline or muscle wasting. In addition to external radiation therapy, there is also an internal radiation therapy. This is commonly known as brachytherapy. In this type of treatment, little seeds or ribbons or capsules about the size of a grain of rice are implanted directly into the tumor or very close to it. These little objects contain radioactive material which destroys the cancer cells which are in that specific area over a certain period of time. This treatment is most commonly used for prostate cancer, although it is now used for some other types of cancers as well. Some of the advantages of brachytherapy are that it has fewer side effects than the external beam radiation therapy, and it also often requires shorter overall treatment periods. Another common type of treatment is chemotherapy. Chemotherapy refers to the use of chemicals to kill the cancer cells. These chemicals can be administered directly into a vein or given in the form of tablets, liquids, or capsules that are swallowed. They can also be applied to the skin or injected directly into a tumor. There are many different types and combinations of chemicals that are used during chemotherapy, depending on the patient and the type of cancer that is being treated. You will remember that one of the features of cancer cells is that they multiply very rapidly. Chemotherapy is designed to target all cells that multiply rapidly in the body, not only cancer cells. So it also kills cells that make up hair, skin, nails, and any other rapidly multiplying cells. This is why chemotherapy patients often lose their hair and have very dry mouths and skin. The idea is once the cancer cells have been destroyed by the chemotherapy, the other healthy cells will grow back, but the cancer cells will not. Other side effects of chemotherapy include the following: extreme tiredness, lowered immunity, nausea, vomiting, and loss of appetite, sores in the mouth, bleeding more than usual from cuts and sores, pain in various parts of the body, diarrhea or constipation, a feeling of having pins and needles in various parts of the body, or alternatively, a loss of feeling or a numbness. Hormone therapy is a cancer treatment for specific types of cancers that use hormones to grow, like prostate cancer and some breast cancers. Hormone therapy is not used as a treatment on its own, but it is usually given as an additional treatment. It works by blocking or interfering with the production of the hormones that help the cancer to grow and reproduce. For example, women who have certain types of breast cancer are given a hormone therapy called tamoxifen. This involves taking a tablet or medication in liquid form every day for 5 years after the completion of their surgery, their chemotherapy, or their radiation therapy, and it greatly reduces the chances that the cancer will return. Stem cells are very basic cells found in parts of the body like the umbilical cord of babies and in bone marrow. Stem cells have a remarkable potential to develop into different cell types in the body during their early life and growth. Stem cells are often used in the treatment of cancers like leukemias, myelomas, and lymphomas. With this treatment, bone marrow containing stem cells from a healthy donor is transplanted into the bloodstream of a patient once treatment with chemotherapy or radiation has been completed. The stem cells then travel to the bone marrow of the patient and replace the cells that were destroyed during the treatment process. In this way, the patient is able to develop new, healthy bone marrow. One of the newer types of cancer treatment is called immunotherapy. This treatment uses the body's own immune system to attack cancer cells. There are a number of different types of immunotherapy, but only one is currently available in South Africa. It is approved to treat only 3 types of cancers, but it is being used in clinical trials for the treatment of many others. Unfortunately, immunotherapy is still extremely expensive. A course of immunotherapy treatment over 12 weeks in South Africa currently costs over 1 million rand. This makes it unaffordable for many. Unlike chemotherapy, which targets both healthy cells and cancer cells, targeted therapy identifies specific cancer cells or molecules within cancer cells and either destroys them or prevents them from multiplying. Targeted therapy can be used as a treatment on its own or in combination with more traditional treatments like chemotherapy, surgery, or radiation. At the moment, there are only a few cancers that can be treated using targeted therapy. You will often hear people say that their cancer has come back. This is called a recurrent cancer. What sometimes happens is that once a patient has completed their treatment, there are still some stray cancer cells left in their bodies, but these are too small to be picked up on scans and do not show up in blood tests either. Over time, these cells continue to multiply, as cancer cells do, until they form tumors that are large enough to detect. This is why it is so important for cancer patients to continue to have regular checkups once they have completed their treatment. The earlier doctors can pick up these recurrences, the easier it will be to treat them.